CELF Preschool 2 is a tool for identifying, diagnosing, and performing follow-up evaluations of language deficits in children 3 to 6 years of age.
The materials included in the CELF P2 are the Examiner's Manual, Stimulus Books 1 and 2, the Record Form, the Concepts and Following Directions Stimulus Sheet, and checklists including the Pre-Literacy Rating Scale and Descriptive Pragmatic Profile.
The Examiner's Manual provides guidelines for scoring all subtests as well as directions for interpreting test performance. It also contains a detailed description of the test purpose, design, and development. Information on reliability, validity, and normative data can be found within the Examiner's Manual. It is essential that the individual administering the test thoroughly read and understand the Examiner's Manual prior to the administration of the test.
Stimulus Book 1 is a spiral-bound book with an easel including tab dividers for easy identification of the subtest. The first page of each subtest contains general information and directions needed to administer the subtest. When the book is propped up, the page with a visual stimulus faces the child, and the information needed to administer each item faces the clinician.
Stimulus Book 2 contains illustrations which correlate to the story for the Recalling Sentences in Context subtest that is located in Stimulus Book 1. The clinician is instructed to present the illustrations to the child while reading the story that is located in the correlating subtest within Stimulus Book 1. This storybook format is designed to be interesting and easy for the child to manipulate.
The record form is used as a tool to record the results of each subtest as well as score the test. It contains the test item choices, space for recording responses and test results, item analysis, and the behavioral observation checklist. The form is divided into sections for each subtest. Each section is then further divided into the following 4 areas: receptive language, expressive language, language content, and language structure.
The Pre-Literacy Rating Scale and Descriptive Pragmatic Profile checklists are provided on a tear-off pad with each checklist located on either side of the sheet. The checklist may be filled out by the clinician, parent, or other caregiver who is familiar with the child. The Pre-Literacy Rating Scale contains 2 sections including Emergent Reading Skills and Emergent Writing Skills. The Descriptive Pragmatic Profile contains 3 sections including Nonverbal Communication Skills, Conversational Routines and Skills, and asking for, giving, and responding the information. Each checklist contains abilities which reflect milestones seen in normal development of literacy skills in children ages 3 to 6.
The Concepts and Following Directions Stimulus Sheet is a laminated sheet providing the verbal stimuli for the Concepts and Following Directions subtest located in Stimulus Book 1. It gives the clinician specific directions on what to say to the child, as well as how the clinician should position him or herself during the subtest.
Jenny is a 4-year-old girl. She was diagnosed with pervasive developmental delays at age 15 months and began early intervention immediately. Jenny presents with significant articulation and expressive language delays, intensified by low oral and muscle tone and respiratory support. Her mean length utterance is 2.5 to 3.0. Jenny's pragmatic skills are also delayed, which has a negative impact on her interaction with peers and adults. She substitutes sounds and has inconsistent errors that occur more frequently as the length and complexity of words increase. Jenny is difficult to understand at times, especially to an unfamiliar listener. Due to the low muscle tone and poor respiratory support, she often slouches and has a voice that is perceived to be soft and quiet. Despite this, Jenny does have age-appropriate receptive vocabulary and is very stimulable for articulation improvement. Basic Concepts evaluates the child's knowledge of concepts of dimension and size, direction, location, and position, as well as number, quantity, and equality. Jenny, look at these children. This is a baby. The baby is little. This is a girl. She is little too. And this is a boy. The boy is big. Look at the children again. Point to the one who is big. Look at these pictures. Point to the one who is sad. Jenny, point to the one that is inside. Point to the one who is pointing up. This one is pointing up.
Here is the scored section from the Basic Concepts subtest. The clinician circled the letter corresponding to the child's response. The clinician also circles a 1 for a correct response and a 0 for an incorrect response. The correct responses are in color. For item 18 in this subtest, the child must give 2 correct responses to score a 1. Word structure evaluates the child's ability to apply word structure rules to mark inflections, derivations, and comparisons, as well as the ability to select and use appropriate pronouns to refer to people, objects, and possessive relationships.
Jenny, I'm going to show you some pictures and say some things about them. I want you to help me by finishing some of the things I say. Let's try one. Here is a boy, and here, girl. Let's try another. Finish what I say. This boy is standing. This boy is
Sitting.
This girl has 2 cats. This girl has 2
Dogs.
Okay, here's some more pictures. Remember, listen to what I say about the picture and help me finish what I say about each one. Here is a girl playing. Here, a girl is
Sleeping.
Here is a baby. The baby is crawling. Here is a girl. The girl is
Walking.
The doll is out of the box. The doll is
Inbox.
Recalling sentences in context evaluates the child's ability to listen to spoken sentences and repeat the sentences without changing word meanings, inflections, derivations, comparisons, or sentence structure.
We're going to read a story together. No juice. Mom and the children were getting ready for lunch. Mom and Amy were making sandwiches and salad. Mark was setting the table, and Billy was looking for mustard and apple juice. Billy looked in the refrigerator. No mustard, no juice. He said, "I can't find them." What did Billy say? Billy said, "I can't find them." Tell me what Billy said. Mom decided that they needed to go to the grocery store. Everyone got in the car. Mom said, "Put on your seatbelts." What did Mom say? Listen carefully and say exactly what I say. You need to say, "Put on your seatbelts." They drove to the grocery store and got a shopping cart. Mom asked Mark, will you push? What did Mom ask? Mom asked, will you push? Mom got some tomatoes, then said, we need juice. As indicated by the test instructions for recalling sentences in context, the clinician is instructed to discontinue the testing if the client does not respond to the demo and 2 trials. However, continuing the story is suggested as indicated by the previous video.
In addition to the 3 subtests demonstrated in this video, the CELF P2 includes the following additional subtests: sentence structure, expressive vocabulary, concepts and following directions, word classes, recalling sentences, and phonological awareness.